All right, this is validation 3, and yes, I will be performing urinary catheterization. And the first thing I'm going to do is to review the physician's order for Foley catheter, and also to make sure I have a great understanding of the reason for Foley insertion. And yes, I also need to check my patient's medical record to check to review allergy, and perform a hand hygiene, grab all my cleaning supplies and equipment, and also get my Foley kit and make sure my Foley kit is sterile and the integrity is not compromised. And I come into my patient's room, knock, knock, knock. Hi, Jane, how are you doing today? Okay, and my name is John Paul, and I'm going to be a nurse today, okay? And I'm going to be with you from 3 to 11 p.m., okay? Yeah, so did you have your lunch today? Oh, that's great. And did you enjoy the food? Oh, great. Thank you. Have any of your family members visited you today? Oh, that's good. Okay, thank you. And basically, you have a physician's order for Foley insertion, okay? And before we go ahead, can you help me confirm your name and date of birth? Okay. And can I see your armband? Great. So, Foley catheterization is basically the insertion of a little tube into your urine bladder, and will be collected. The urine will be collected down here on the Foley bag here. Okay. And once it's done, you don't need to stand up to go and urinate again. You can just relax and urinate from the bed here, okay? And if you want to stand up to walk around, that's fine, you're good, but make sure you grab the Foley bag, okay? All right, okay. And could you help me confirm the last time you urinated? Oh, great. And did you feel like you emptied your bladder? Okay, all right, okay. All right, so the first thing I'm going to do is that do you want me to go ahead with the procedure? I should go ahead? Okay, that's good. Thank you. I'm going to call one of my colleagues to join me to assist me, okay? All right. Hi, Amanda. Please, can you join me here? Please, can you assist me? All right, thank you. Uh, they'll come back to my patient, and I have to position my patient. But before I do that, would you like me to help? I'm going to help and change you and clean you up, change you the pad to make sure to avoid any infection control, to avoid any infection contamination, okay? All right. Okay, so I provide privacy, do my hand hygiene, wear my hand glove, raise the bed up, remove the handrail, okay? And do you want me to open this? Okay, thank you. All right. Change the pad. After changing the pad, okay, position my patient. For the male patient, I have to get the leg flexed, and the male patient, I have to get the leg straight. I can access the penis here. But for female patient, I have to flex the leg and open it wide. Yes. So after doing that, yes, I have to get off my hand glove, perform my hand hygiene. Okay, I'm gonna give me a few seconds to set up my Foley kit. Okay. All right. I'm gonna use it back as my tripod. Put it here. Okay. Get this out. Get this out. Adjust it. Observe the borderline for contamination. Get this. Don my sterile glove. Make sure the arrow points at me. All right. Okay, get this out. Go back, open it, and make sure the grocery part is facing me. And I'm gonna go to my patient, fan it to the leg. Good. Go back. Get this. Adjust it here. Make sure it doesn't contaminate the borderline. Okay. Take this up. Open it. Get this out. Yes, this is for male patient for extra coverage from contamination. I'm not using it. Get my swab. Open it. Get it ready. Come back here. Trash it here. Go around. Get the oil. Open it. Come back here. Trash it. Okay. Get my syringe. Inside my syringe. And get my it is removed. Okay, go around, trash it. Okay, take this, cover this one to my patient. Hi Jane, I'm here now. So we're gonna start the procedure, okay? All right. Can you take a deep breath? Out. Okay, good. All right. Okay, so I'm gonna do the first of all. I'm gonna do the wiping of do the pericare. After the pericare, then I'll insert the Foley. Okay. All right. Thank you. Yes, I have to lubricate. If it is a male patient, I lubricate 5 to 7 inches. If it is a female patient, I lubricate 1 to 2 inches. Okay. All right. So grab this with my 2 hands. One side up, down, go around, trash it. One side up, down, go around, trash it. Once at the middle, up, down, go around, trash it. And the next thing is to insert the Foley. While inserting the Foley, I'm going to make sure if it is a male, I have to insert it 7 to 10 inches. And once I see the flash of urine, I'll insert extra 1 to 2 inches. But if it is a female, I'm going to insert 2 to 3 inches. And once I get the flash of urine, and I'm going to insert extra 1 to 2 inches. Okay, hold it very tight and go ahead. Go ahead. Go ahead. Go ahead. And once I get a flash of urine, I insert it extra 1 to 2 inches. Okay. So the next thing I'm going to do is to inflate my balloon. After inflating my balloon, okay. After inflating my balloon, I will make sure I hold this very tight to make it stable while inflating my inflating the balloon. Then when I'm done, go around, trash it. Okay, so now the next thing I'm going to do is to cover this, cover the blue one. So after covering the blue one, I'll tape it to the patient's lap. After taping it to the patient's lap, get this out. Okay, so what I'm going to do now is that I'm going to make sure I clip it to the bed. I clip it to the bed. Make sure I observe the gravity. And yes, if I need a urine sample, sterile sample, so I go ahead, open it. Open the lid. Get my sample. After the sample, I'll close it back. Close my urine. I'm going to take it back, this one, to the lab. Clean it with a swab. Cover it back. After I put it back, pinch it back, cover it back. Okay. So I take this one down and clip it to the bed. Yeah, so when I'm done clipping it to the bed, the next thing I'm going to do is to clean up my patient, make a pedicure as needed, and take off everything here and clean up the place and wipe it off. So after wiping it off, and so the next thing I'm going to do is to cover my patient. After covering my patient, I make sure he's comfortable. Yeah, you comfortable now? All right. You feel any pain? No pain. Okay, good. So clean up the bed, clean everywhere up, and get the bed down. Raise the handrail and remove my hand glove. Perform my hand hygiene, and this is a call light. Okay, this is a call light. Okay, so just call me if you need anything. Okay. All right. Thank you very much. Do you have any question for me? All right. Do you want me to get you any drink? Okay. What do you want? Apple juice. Okay, I'll get it for you. Okay. All right. Clean everywhere and go out. Then once I get it out, I have to go and document, chatting to the time and the date of insertion, and if there's any obstruction at the course of insertion. Because if there was a particular obstruction, I would have not continued with the procedure. I would have called another nurse, but at least I need to try like 1 or 2 times. If I didn't succeed, I have to call somebody else to continue. Okay, so I have to chat in if there's any obstruction, and yeah. So, and that is it. The bed, I have to get the bed down before leaving the patient room, and rest it. Yeah, leave, come back again the day for Foley removal. Yes, I'm here. Before coming into the patient's room, I have to review the doctor's order for Foley removal and check any allergy, no allergy. Then grab my 10mm syringe, grab it, come in, and yes, knock, knock, knock. Hi Jen, how are you doing today? You doing all right? Okay, so you have doctor's order today for Foley removal, okay? And before I go ahead, can you confirm your name and date of birth? Okay, and yeah, can I see your armband? Okay, that's good. So we'll be removing your Foley today, okay? All right. Okay, so the next thing I'm gonna do is to perform a hand hygiene, wear my glove, okay, get the bed up, remove the handrail. Can I open this? All right. Okay. All right. So the first thing I'm gonna do, I have to deflate. Open this. Draw it and deflate it. After deflating it, lock it, trash it. After trashing it, so I use paper towel, get this out. Okay, take it up and make sure the urine collects down here. When the urine finish collecting down here, I have to measure the urine and take it off. After taking it off, I trash this. Trashing this, clean up the place, cover my patient back. Okay, cover my patient back, and lower the bed, take up the handrail up, and yeah, Jane. So you are expected to urinate in the next 6 hours. Okay. So if you have any pain or you feel any trouble urinating, just let me know. Okay. All right. Thank you very much. Here is your call light. So call me if you need anything. Okay. All right. So go out, perform my hand hygiene. Go out, chart the dates, time and date of removal, and also the due time for void in the next 6 hours. So if it is 9 o'clock, if it is 4 o'clock, so it's meant to, void in the next by 10. Yes, 6 hours. So, and that is it. And make sure I chart in the characteristics, the type of urine and stuff like that if I any encounter. And that's it. Thank you very much. Bye.